Good evening and welcome to our COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Today, federal government encourages local manufacturers to go into face masks production as Nigeria witnesses community spread of coronavirus. Minister of Health warns unaccredited health personnel to handling COVID-19 cases to desist. And scientists in the UK insist on strict social distancing measures until vaccines are found. Welcome, everyone. The economy appears to be the most affected by the coronavirus pandemic. The government of Nigeria is making efforts to see how the effect of COVID-19 can be mitigated. The Vice President, Professor Yemi Osinbajo, today chaired the meeting of the Economic Sustainability Committee at the Presidential Villa. The committee, which was formed by President Buhari at the end of March, is tasked with tackling the economic challenges and fallout of the COVID-19 pandemic to come up with palliatives for the populace, create a sustainable plan to reposition the economy. The meeting is timely considering the calls in different quarters for palliatives to reach a wider number of Nigerians. Among those present at the forum included the Ministers of Finance, Works and Housing, Humanitarian Affairs, the Minister of State for Petroleum Resources. And now the presidential task force continued to count on all Nigerians on the efforts to containing the virus. The secretary to the government of the Federation today said the government needs to ensure that stricter compliance of the lockdown is observed. He also emphasized the need for local manufacturing of face masks.
The PTF appeals to Nigerians to take responsibility and play their roles properly. As you all know, we are in a state of war against an invisible enemy. Let me also advise that whenever you are outside the confines of your home, make sure it is for very legitimate reasons covered by the exemption, or within the hours relax for the purchase of basic items. Similarly, you should carry with you a valid means of identification. Finally, I urge everyone to please exercise patience in communicating with the law enforcement agents assigned to ensure compliance with the presidential orders. They are there to protect all of us. The PTF continues to count on the collective cooperation of all Nigerians in our effort to contain the spread of this deadly virus.
The Minister of Health focused on medical practitioners as he asked unaccredited healthcare workers not to attempt to treat coronavirus patients, insisting that it is an infectious disease.
Our valuable health workers are urged to adhere to all government instructions and regulations, to always utilize personal protective equipment as the situation demands, to maintain a high index of suspicion for COVID-19 infection, and to protect themselves, their loved ones, and their colleagues. I use this opportunity to again strongly advise my colleagues in medical profession against secretly or privately managing people who have COVID-19 infection outside of accredited health facilities. We cannot afford to have avoidable morbidity and mortality. Private facilities must obtain accreditation in order to be allowed to treat this highly infectious disease. Practitioners engaging in unauthorized treatment of COVID-19 run the risk of being shut down, their hospitals being shut down, for decontamination. This next phase of our strategy in the health sector, due to the available evidence of increasing community transmission in Nigeria, now focuses on community response rather than individual travelers and their contacts in society.
For the Foreign Affairs Minister, Geoffrey Onyema, all plans are set to evacuate Nigerians who are willing to return to the country. He said the airlines have been identified and a decision is soon to be taken on the arrival time and date.
On the issue of evacuation of Nigerians, where we are now is that we have received all the numbers from our various embassies around the world. We are collating those. Then we have now selected 2 airlines that will be responsible for going to fetch them. The numbers are high, and the places where we can isolate them are not enough for those numbers. So we will have to do it in a staggered fashion, and together with the National Emergency Management Agency and the Ministry of Health, we will have to come to an agreement to be bringing back according to the numbers of beds and so forth that are available. But as I said, we have now identified the airlines that will go out in the process. So we're almost ready to go.
In the meantime, figures from the Nigeria Center for Disease Control (NCDC) shows that a total of 407 cases of COVID-19 has been recorded, with the number of discharged patients at 128. The breakdown of the figures show Lagos with 232 cases, the FCT 58, Osun 20, Kano 16, Edo 15, Oyo 11, Ogun 6, Katsina, Bauchi and Kaduna, Akwa Ibom 6 cases each, Kwara Delta 4 cases each, Ondo 3, Enugu, Ekiti, Rivers, Niger States have 2 cases, with Benue and Anambra States 1 case each. Earlier today, the Lagos State Commissioner for Health, Professor Akin Abayomi, revealed 2 additional deaths, plus that of a medical practitioner related to complications from COVID-19, he said has been recorded in the state. In a tweet by Professor Abayomi, their ages are between 51 and 52. One of the dead, a medical doctor, he said, had contact with an infected person who recently returned to the country, while other victims had no travel history or record of contact with any infected person. He urged Lagosians to remain vigilant, report any concern about COVID-19 infection in their communities by calling 08000 Corona. However, moments ago, via a tweet, the Lagos State Governor revealed that 5 more patients, 3 females, 2 males, have been discharged from the Mainland Disease Hospital after testing negative twice. The National Commission for Refugees, Migrants and IDPs have been distributing relief materials like food items, clothing and medicals to internally displaced persons living in Dutsima and Savannah local government areas of Katsina State. According to the Federal Commissioner, Mr. Bashir Mohammed of the agency, the palliatives will come in handy to ease the economic hardship occasioned by the pandemic. Over 200 persons benefited from the distribution.
As you are aware, Mr. President is very concerned about the well-being of our IDPs. As such, he has made it very clear to all the agencies operating within the humanitarian space, that is in the humanitarian space, to pay special attention to them, especially in these trying moments. As the agency that is mandated to provide care and maintenance, we will continue to do our best to make their lives better. It may interest you to know that we have over 290 IDP camps in Nigeria with a population of about 2.3 million people. Obviously, government cannot do it alone. The resources are stretched.
Latest figures from the Department of Health says a total of 12,868 patients died in hospital after testing positive for COVID-19 in the UK as of 5 p.m. on Tuesday. Dr. Hans Kluge, the World Health Organization Regional Director for Europe, describes how the storm cloud of COVID-19 still hangs heavily over the European region. He also says that of the 10 countries in the region with the highest number of cases, there have been optimistic signs in terms of the climbing numbers in Spain, Italy, Germany, France, and Switzerland in recent weeks. But he says small positive signals in some countries are tempered by sustained or increased levels of incidence in other countries, including the UK, Turkey, Ukraine, Belarus, and Russia. According to a global burden of disease study, deaths in the UK is expected to peak with an estimated 2,932 deaths on the 17th of April. And predictions are over 60,000 total deaths in the country by the 4th of August. Joining us right now is Dr. Emeka Okrocha, Emergency Medical Department, London. He joins us via Skype. Thank you so much for joining us, Dr. Okrocha. Now, one of the main factors in calculating the potential death rate on COVID-19 is the country's intensive care, the bed capacity. Now, some reports suggest that the UK will not have enough ICU beds to meet demand. Tell us the case where you operate in the UK.
Yeah, you're very right in saying that, but that's an issue that I think definitely comes into factor when you're thinking about mortality rate of the patients we're getting in. Obviously, we have a grand number of patients coming in, much more than we've ever been used to and expected for this type of condition. So this meant that we've had to increase our number of ICU beds. So what we've done is we've converted a number of wards, what we don't consider emergency wards at the moment, and we've transferred them into ICU wards. So we've been able to increase the number of beds that we actually have and increase the number of spaces that we have for unwell patients by doing this. So we're trying to expand as the needs come, in other words.
Tell us, looking at the number of cases worldwide and also the number of those discharged, do you think perhaps the levels of testing varies from country to country?
I think, yeah, when you think about it now with 2.1 million cases and people testing positive, I think this could even be underrepresentative of how many people have actually been exposed and had COVID-19. I think that the testing, obviously what we've been doing in England, pertains to the people that we're admitting with COVID-19 symptoms. So this comes under people who are suspicious of having the coronavirus. However, there are a number of people who are symptomatic and still at their homes, self-isolating as the government intends them to do if they don't feel they're unwell enough to come into hospital. So obviously these people aren't being tested. Also, we're just starting to test NHS colleagues. In England, we're aiming to test over 100,000 people per day by the end of April. Obviously, this isn't in place as of yet, but it's something we're trying to do. So this could increase the number of cases we're seeing globally, obviously here in the UK. And so this may be more representative of the stats we're seeing at the moment.
Give us, finally, briefly as well, your thoughts about how we're trying to stem the spread, community transfers here in Nigeria. I'm sure you're following the updates on the pandemic here.
Yeah. So, sorry, say again? Did you say something?
Go ahead.
Yeah, sorry, I think it cut out there. Looking at in Nigeria, obviously, I feel like the countries in Africa weren't as affected as Europe, coming from China originally. I think there have only been 12 deaths in Nigeria and about 407 cases, with them mainly coming in the urban areas such as Lagos and Abuja. which kind of represents what we're seeing here in the UK, as in with the main cases coming here from London. So I think in terms of maintaining spread, what we're seeing is that we have an affluent transport system here. And so we've had to shut down a lot of transport and go into self-isolation in order to stop that spread. How it's been done in Nigeria, I think, is a similar thing. But obviously, you can tell the infrastructure is different. So things are going to be different in terms of what the government and the police and the doctors and the health commissioners have to do to contain the spread of coronavirus.
Essentially, stricter measures. Thank you, Dr. Emeka Okorocha, Emergency Medical Department, London. Thank you for joining us at this time.
Thank you very much.
Still to come on our COVID-19 update, while the US considers reopening its economy, UK announces the lockdown measures must remain in place for 3 weeks. We have that story, and also the UK scientist who's advising on a significant level of social distancing. Do join us again. Welcome back. States across the country continue to adopt more measures in preventing the spread of COVID-19 in their states. While some are stopping the influx of travelers, others are providing palliatives. We begin in Kwara State, where the governor, Abdurrahman Abdurrazak, has announced the release of 2 out of 4 confirmed cases after they tested negative twice to COVID-19 in the state. The governor thanked the people of Kwara and the state's healthcare workers for their support and professionalism during the lockdown, which he says is to flatten the curve of transmission. As part of measures to contain further spread of COVID-19 in Kaduna, the state government has stepped up strategies by transforming the National Youth Service Core Orientation Camp located along the Abuja-Kaduna Highway into a quarantine center. This is for travelers coming into the state during the lockdown. The state's Deputy Governor, Hadiza Balarabe, inspected the facility today and warned unauthorized persons coming into the state to turn back or be ready to be quarantined at the NYC camp for 14 days. From the FCT, the National Union of Pensioners, they're questioning the exclusion of its members from benefiting from palliatives that are currently being shared across the country. In a statement signed by the Secretary General of the union, it noted that pensioners are not included in the list of the targeted people receiving the palliatives, even though pensioners are among the most vulnerable. And to Cross River State, where the governor, Professor Benayadi, has flagged off the distribution of a stimulus package to vulnerable persons, as well as citizens who cannot fend for themselves due to age or incapacitation across 18 local government areas of the state. And finally, Enugu State government discharged a COVID-19 patient from the treatment and isolation center for COVID-19. The state's Ministry of Health said the other patient is stable and responding very well to treatment. Well, let's go on to discuss more of the issues as a result of the pandemic. And joining us in the studio is Dr. Indiri Elawar, who's a public health physician. We'd like to welcome you to the program.
Thank you.
Tell us, the stigma of the virus appears to be becoming a problem. We have suggestions from health experts that this might be the cause of where we're having more cases as a result of communal transfer. How do you think we can resolve this?
Well, I don't think the stigma is a huge problem. People have been coming out to tell their stories. Governors have declared that they were positive. I mean, when they got positive and when they got negative, they've also been told. They've also told the people that they're negative. So for me, I think education of the people is very important about the virus. I mean, it's not too different from some other diseases that is killing people every day. You know, I mean, when there was HIV, there was stigmatization, probably because of the mode of transmission. But I mean, with this, it's respiratory, it's a virus. I mean, you don't have to do anything wrong, in quotes. You know, so the issue is about educating people, making them understand. But that as it may, what is the educational status level of the population?
Perhaps I was going to talk about that because based on education, which might also be sensitization, the Minister for Information today said that that's fake news. People who say there's not enough public enlightenment is fake news. He says an NOI poll agree, 91% of that poll agree that are aware that coronavirus exists.
Yeah, a lot of people are aware. I will say that because I'm quite involved even in community sensitization and mobilization. And I will say a lot of places have been reached, a lot of places have been touched, but you can't do enough. You need to explain further and further to people. You also need to know that information changes virtually in 6 hours, 8 hours. So if you send a message across to a community today, by the time you're going tomorrow, something different is coming up. Like now, before you have to call a number to test. Now there are a lot of test centers that have been set up.
In
so
Lagos,
yeah,
for
in
example.
Lagos, for instance. So every day there's something new to tell the people. So if people go beyond the current trend of what are we going to eat, when you take health education to them, people are asking you, bring money, bring food. So I think if people go beyond that and settle down to listen to what has been told them, a lot of people are actually out mobilizing, sensitizing people from the mass media, from different media. So I don't think that sensitization is low. I just think that we need to do it probably in other fashions and do it in a language and mode that people would understand, depending on the strata of people you're talking to.
On the subject of sensitization, let's look at the NOI polls. A few of Nigerians said that their belief in God, preventive measures which they adhere to, the fact that they have black skin, the hot weather and the good food they eat, and a few who say they're actually immune to COVID-19. These are a few of the responses from Nigerians with regards to the poll. What do you make of these
I also say
responses?
that the poll is available to a particular set of people who are online. Because I don't believe they went house to house. I mean, it must have been conducted online or something, so that kind of survey. So for people that are not online, that is not representative of what they feel. We know generally in Nigeria, we tend to believe in God, a feeling of invisibility, that I can't get the virus. But we know that it can happen to anybody, and as the days unfold and we're seeing more people getting tested and more cases coming up, it's beginning to get to us that, look, this is serious and we need to take it seriously.
All right, we'd like to appreciate your time, Dr. Indiri Elawar, public health physician. Thank you for joining us on the program.
You.
And from Edo State, the task force on COVID-19 led by the state's deputy governor, Philip Shaibu, has banned street trading across markets in all the local governments of the state. Briefing journalists in the state capital, Mr. Shaibu said the ban became necessary as a way of ensuring social distancing, particularly for street hawkers and traders during the period. The deputy governor had recently expressed dissatisfaction over crowds seen in marketplaces in some parts of the state. Professor Neil Ferguson, whose scientific modelling has guided the UK government's coronavirus strategy, says the nation will need to keep up some form of social distancing until a vaccine becomes available. His comments came as the UK extended its coronavirus lockdown for 3 weeks. Meanwhile, the EU Commission President has apologised to Italy, saying that too many were not there when Italy needed at the early stages of the pandemic.
The United States has seen its highest daily death toll yet, with nearly 2,600 people with COVID-19 dying in the past 24 hours. That's not just the country's highest number, but the highest daily toll of any country worldwide. The figures came after President Donald Trump said the U.S. had passed the peak of new cases.
The battle continues, but the data suggests that nationwide we have passed the peak on new cases. Hopefully that will continue, and we will continue to make great progress. These encouraging developments have put us in a very strong position to finalize guidelines for states on reopening the country.
Over in Europe, the president of the European Commission, Ursula von der Leyen, has offered a heartfelt apology for letting Italy down at the beginning of the coronavirus pandemic. Italy has the highest death toll in the region, with more than 21,000. It's followed by Spain, France, and the UK. In Asia, it's been an election like no other. Amid the coronavirus outbreak, South Koreans went to the poll on Wednesday. But with strict distancing in place, the vote went smoothly, and President Moon Jae-in's ruling party has won a decisive victory. South Korea was one of the first countries hit by the virus outside China, but has since managed to contain the spread like few other nations.
NCDC Nigeria continues to work closely with states to ensure the safety of Nigeria's frontline workers. You can find the latest public health advisory to Nigerians on the coronavirus disease. The website comes alive with all the information. So as well, the World Health Organization takes you to the live feed of its website each moment, regular updates about the spread of the pandemic. The global COVID-19 strategy on their website guides the public health response at both national and subnational levels. Well, that's our COVID-19 special edition on Channels Television. Thank you for watching. Another COVID-19 update comes your way at 9 p.m. Do join us then. I'm Millicent Walker. Stay safe.